Assalamu alaikum and good afternoon. I won't be able to match up the speed of Dr. Faisal, but I'll try to keep up as much as I can. This is me. So, this meeting is organized by GSK Pakistan. So, quickly going through RSV introduction, first of all, transmission and seasonality, let's talk about it. RSV is obviously a very contagious virus, right? It spreads through the inhalation of the respiratory secretion from an infected patient. It has a respectable R naught of around 3. I hope everybody knows about the R naughts after what we went through during the COVID era. Then, when the patient is infected by RSV, the patient remains contagious for around 3 to 8 days, especially the older adults who shed the virus for a longer period of time, right? Generally, it spreads in the households. Generally, the younger children are the reason they bring the virus into the home. Then it spreads to other people in the home. Older adults are generally at more risk of severe infection. So this is something that you'll be hearing a lot from me regarding the older adults, since we are talking about the burden of disease in the older patients. So RSV happens in epidemics. Epidemics don't just depend on the months, but the time of the year, but it also depends on the location where we are located, right? Like the temperate areas, which are colder, the epidemic happens mostly, it starts mostly at the start of the winters, like, October or November, and it ends near March. While we are talking about, when we talk about tropical areas, the epidemics happen in different episodes. There are two types of subtypes of RSV, RSV-A and RSV-B. RSV-A is generally the dominant form globally, but any subtype can predominate over the other at any given time. And the symptoms are essentially the same. So clinically, it doesn't really hold any difference. So RSV is a disease of all ages. It can affect any age group, ranging from infants till adults. Children by the age of 2 years, almost all of them are infected at least once. The immunity acquired by the infection is generally short-lived. It doesn't last for very long. So one can get recurrent infections because of it. Now, these are the older patients that are at high risk of severe infection, right? Especially those who have comorbidities, certain comorbidities like cardiac disease, pulmonary disease, diabetes, chronic kidney disease, and others. Now, this is a meta-analysis from 67 studies that showed that RSV actually accounted for around 10% of all respiratory infections in adults older than 50 years. This is a big number. If you look at our part of the region, Asia and Europe actually leads the way with most number of RSV cases. So what are the risk factors for severe infection? Older age, as I initially stated, is the most important factor for severe RSV infection. Along with that, comorbidities like pulmonary disease, especially COPD patients are at extremely high risk of getting RSV. Patients with cardiac disease like heart failure, diabetes, CKD, those with immunocompromised state, those living in certain conditions that are kind of congested, living in low socioeconomic status, and those having a nursing home residence. All of these are at increased risk of getting severe RSV infection. In fact, one of the study from US stated that more than 60 years of age hospitalized patients with RSV, almost all of them had one or more of these underlying conditions, these comorbidities. Again, re-emphasizing the fact that age is a very important factor, we can appreciate that here most number of cases are being reported in the age group of more than 75 years. right? Again, here we can see that those patients who have aged more than 75 years, they have a more number of cases reported, more hospitalizations, more ICU admissions, and obviously more number of deaths. If we compare patients with comorbidities with those who don't have comorbidities, we can clearly appreciate here that as these patients have higher number of higher incidence of severe infection and more hospitalization because of RSV as compared to those patients who don't have these comorbidities. Talking about COPD, if a COPD patient acquires RSV infection, he has more chances of getting COPD exacerbation and more ICU admissions, more need for mechanical ventilation, and increased mortality. Numbers are not too different with asthma, but mortality is slightly less as compared to COPD patients. Diabetes is an important risk factor for acquiring severe RSV infection, especially if diabetic patients are concomitantly having CKD. They tend to have a severe disease and they tend to have worse outcome as compared to the patients who don't have diabetes or CKD. Patients with heart failure, the story is not too different again, especially those patients who have an age of more than 65 years and heart failure, they tend to have a much worse disease and more increased incidence of RSV. In hospital, cardiac events, the patient, now there are two groups of patients. One group is the patient with pre-existing cardiovascular disease, another group is the patient who don't have cardiovascular disease. Now, incidence of in-hospital cardiac event, especially myocardial infarction, is significantly increased in those patients with pre-existing cardiovascular disease in patients who acquire RSV. I'll skip it. Okay. The outcome. Now, RSV is prevalent. We know this. RSV is quite prevalent, but it is under-recognized in older patients. Why is that? Because testing is not readily available, not universally available. Furthermore, the testing kits or the testing methods that are used by different researchers, they are not standardized. They yield different sensitivities and specificity. That's why the reports or the cases are generally underreported. Okay. The RSV mortality is highest not just in adults with more than 65 years of age, but also in infants. We can appreciate here, these are the number of admissions that one needs. So children less than 1 year of age require the most number of admissions, followed by the patients who are more than 65 years of age, and subsequently this number increases. Similarly, if we talk about the mortality is also increased in patients with age less than 1 year, and similarly those at the other extreme of the age. Talking about the long-term impact of functional status in older patients, we can appreciate here that around 8% of the fewer patients were living independently at 6 months post-discharge. Right. If you put it in a broader picture, these patients, among these patients, approximately 1/3 reported decline in functional status at 6 months post-discharge. Up to 24.5% required professional home care. Up to 26.6% patients required readmission within 3 months of discharge, and a cumulative mortality rate of 26% or 25.8% within the year of admission. I think these are quite staggering numbers. And the quality of life, patients report low energy levels, more fatigue, decreased social functioning, and limitation in physical health overall after admission because of the RSV. If we compare it with the other viruses, I'll skip it. Well, symptoms don't help much when we are trying to differentiate between different respiratory viruses like influenza, COVID, coronavirus, or metapneumovirus. Symptoms don't help much. Upper respiratory symptoms, lower respiratory symptoms, and systemic symptoms are all pretty much the same. But if we compare influenza with RSV, we already know that RSV has more predilection for those patients who are older and who have more comorbidities like lung disease or cancers or rheumatic disease, hypertension, renal disease, and others. So RSV disease severity is similar to or worse than the severity of influenza and COVID. Here we can appreciate, if we plot RSV with influenza, we can see that patients with RSV required more supplemental oxygen, more advanced respiratory support, they had more organ failures, they have more ICU admissions, and increased mortality. The numbers are not too different when we compare RSV with COVID. In-hospital mortality is generally higher in adult patients with RSV compared with influenza across all age groups. We can see here that the mortality is significantly more in RSV infected patients in the age more than 60, except for this part where more than 90 years of age patients displayed more mortality in the influenza group. Previously, what we saw was all the patients were studied in the high-income countries. Now, if we talk about the middle-income countries, the story is not too different here either, right? The mortality is high, especially in increased age group. So, if we conclude, generally RSV is considered to be a disease of pediatric age group, which is not entirely true. So it's time that we focus on adult patients, especially the older patients who have more comorbidities, start vaccinating them. Although vaccine is still not available in Pakistan, but I hope different pharmaceutical will be trying to get it available in Pakistan as soon as possible, and we should be educating all the internists who are coming into contact with the patient, first-hand contact with the patient. They can educate them to get vaccinated and subsequently decrease the mortality because of RSV. Thank you.